Great. Hey, welcome everyone to session 8B, and this is TMC operations and the impact of COVID. This is Dan Core. We're going to wait about another minute or so the room can fill up, and then we'll get started. So grab your late lunch, drinks, whatever you have, and as I said, we'll get going in about 30 seconds. And thanks for joining. All right, we'll get started. Again, welcome everyone. We've got a good crowd here. This is session 8B. This is the final session of the day on this track. I'd like to thank everyone for coming and for participating in the annual TSC conference. We've had a lot of great sessions throughout the entire conference. Appreciate you all attending. And we're going to end with a bang. This is a great group of people who are going to be talking about TMC operations. And not only is it TMC operations, but the impact that we've all been going through with COVID as we're all working from home, schooling from home. How's that impacted how our roads are watched, monitored, operated, how we have emergency services being deployed. So we have three different groups, I'm going to call them, of folks today. We've got the Pennsylvania Turnpike with Mike Pack and Nate Keel. We have PENNDOT represented by Dan Farley and Dave Gaffney. And then Matt Lee from AECOM is going to be giving kind of more of a national perspective. So with that, I'm going to pass along to Mike Pack and Nate Keel. But before I do, a couple of reminders, folks. We do have the Q&A bar underneath. If you do have questions, please don't hesitate to type them in as we're going through this session. I'll be monitoring those and bring up those questions as they come along, so don't be shy. This group is very energetic, and hopefully we'll see some surprises as we're going through. So Mike, what I want to do is I'll have the Turnpike come up. If you guys could do a quick introduction of yourself and Nate, your roles with the Turnpike. And you guys always know there's always a fun fact that I want to know. With this group, let me know your favorite food or meal that you would like to have. And then Mike, give me the go ahead when you want me to start the video. All yours, Mike.
Yeah, on the spot here, favorite meal. I like all foods, Dan.
Exactly.
Mostly carbs, but yeah. I'm Michael Pack. I'm the manager of incident management and traffic operations at the Pennsylvania Turnpike Commission. And with me today, Nate, I'll turn it over to you. Introduce yourself.
Thanks, Mike. Nate Keel, Assistant Manager of the Traffic Operations Center for the Pennsylvania Turnpike Commission.
Yep, and one more fun fact. I went from the jungle of the Turnpike to the jungle in my house, by the way. And this wraps around the room, and I did get a text from someone that is joining in and has said he appreciates the Toy Story background. Okay, Dan, you can go ahead and start the video.
I appreciate that, and Here we go.
At the Pennsylvania Turnpike, safety is our top priority. In our traffic engineering and operations department, we use the latest technology to keep traffic moving safely all along our 552-mile highway system. Engineers, incident management experts, and dispatch operators, combining data and technology as part of our extraordinary commitment to safety. Developing award-winning apps, building first-in-industry notification programs, revolutionizing traffic control and highway safety.
Most of the innovative technologies we're looking at is just to increase safety, especially in the work zone. Yeah, I think going out of your way to try to improve, safe technology is huge. How can this project keep traffic flowing safely? How can we prevent queues, backlogs of traffic in work zones?
Our state-of-the-art operations center is the communications nerve center, managing 400 calls and 11,000 radio transmissions every day. Using sophisticated technology, we can study traffic data and predict where accidents are most likely to happen. And we've received international recognition for building an app that shares this information with emergency personnel so they can respond more quickly.
We can actually go on here, and if we see an incident and it shows that there's a slowdown in a specific area, then what we can do is we can click on that incident, pull it up, and see exactly what's going on. It is critical that we know as soon as possible if there's an issue out on the roadway so that we can take necessary steps to avoid extended delays.
America's first and finest superhighway relies on engineers, incident management experts, and dispatch operators to keep our customers safe. Check our website for the latest job listings, because miles of opportunity start here.
Very good start, Dan. We appreciate you sharing that video. You know, we're very excited with what we've been able to work on and accomplish over the past few years, you know, with our Traffic Operations Center folks, such as Nate Keel that we have on with us today. So I'm going to go ahead and share my screen, Dan. Pull up my presentation here. Okay, can everyone see my screen?
You're good, Mike. You're just not in presentation mode, just so you know.
Okay. All right, how's that?
Perfect. You're good.
Good to go? Okay, awesome. Okay, everyone. So what I'll do is I'll kind of give a quick overview of the Turnpike and talk about some of the impacts that we've seen during the pandemic when it comes to traffic volumes and overall operations. And then Nate will finish it up with what we've done from the Turnpike perspective as far as operating in our TOC and actually splitting up shifts between different facilities during the lockdown. And actually, we're kind of back to that right now, but he'll go ahead and talk about that. Real quick overview of the Turnpike system. Total of 552 miles. Obviously, we have the largest is the east to west corridor from Jersey to Ohio. We have the northeast extension, 110 miles, and we do have 4 smaller western extensions out in western PA. Pre-COVID stats, you can see that we were over 576,000 vehicles a day, and our annual revenue was 1.2 billion last year. Obviously, like every other agency, not just toll authorities, but I know that DOTs are feeling the pain as well with reduced vehicles and reduced tax revenue. Our truck traffic is running at around 14.5%. Even though it's only 14.5%, our total revenue from our commercial vehicles are 44%, which honestly really did save us through the reduced volumes through the pandemic. So to move on and talk about kind of our volume, speeds, revenue, and other impacts that we've seen. This is our impacts of traffic volumes weekly. So all the way to the right is March 1st of this year, and then as you move left, we end up into October and November. But you can see towards the right, mid-March is when all of us really kind of were told to shut down. Businesses closed. People lost their jobs. Or a lot of us working from home. So that's when we saw the most drastic hit to our traffic volumes. You see, we went from 3.5 to 4 million vehicles for the week of March 1st to around 1.5 million as we hit into mid-March. And you see it did take some time for us to bounce back. Even though we're not completely to normal, in June, July, you really kind of see the volumes pick up to what's really been the new normal for this year in 2020. Volume comparisons, the monthly view. You can see, March, obviously mid-March when we locked down, started to take a hit, and then April, really the full month of April, we were really kind of in that lockdown, and that was obviously our biggest hit to our traffic volumes. And you can see it bounce back monthly from May to June, and then July, August, and the summer months back to somewhat of our new normal. This is an example of a specific project, our resurfacing job between 299 and 306. So between our Morgantown and Downingtown exits. So along the top, you can see top left, March 1st, you see our volumes were actually trending higher than the prior year. And then as we got into mid-March and into April, you see the volume substantially decreased. So on the bottom, on the left is a chart. So these are our lane charts that our traffic engineering folks maintain. And what it shows is the number of available lanes that must be maintained, number of lanes that must be maintained for the specific time of day. So During our normal volumes, you can see that all 7 days of the week that, for really the daylight hours, 2 lanes must be maintained. As you get to the right is a new lane chart, April through May, that was based on the reduced traffic volumes from the pandemic. And you see that you could basically go out there and work anytime, with the exception of Friday from 5 a.m. to looks like 7 p.m. And then as we got into April, May, and in through June, you see April, May, as volume started to bounce back, you see that some of the peak hour traffic started to come back at that particular location. So we did have to maintain 2 lanes of traffic for the AM and PM peaks, as well as the same hours during Friday. And then as we got into May and then into June, with volumes bouncing back, not to normal, but closer to normal, you see that the lane charts were much closer to normal as far as when maintenance and construction were able to actually set their patterns. Impacts to speeds. We did see during the mid-March to April and May, 19% increase in speeding in our work zones. You see there are 38% in March pre-COVID versus 57% in April. We did see our excessive speeding, 11 plus mile an hour over the limit, did more than double from 6% in March to 13% in April. And we did see the 95th percentile speeds increased by 5 mile an hour. And what this meant to us, so what I showed you with the lane charts, that our maintenance construction folks were able to get out there and work more. Speeds did increase. So with our maintenance folks out there working, setting more mobile patterns, trying to get more work done during the normal business hours, we did see a big spike in our hits of our truck mount attenuators, or our TMAs. We did have 5 hits within a very short period of time in April and in May that we saw, and it was primarily due to the left lane patterns that they were running. So we actually suspended, working closely with maintenance and traffic engineering, work closely with everyone to look at that MPT pattern. And what they did was they added a second portable changeable message sign requirement in advance of those mobile patterns before they were able to resume that type of pattern. Operational impacts. This is an incident comparison from calendar year 19 to 20, month by month. And you can see that the decreases that we've seen just in overall incidents. So incidents involve accident, disabled vehicles, debris on roadway, deer hits, pretty much everything that our traffic operations center technicians will enter into our CAD system. And you see, as we got into the summer months, the number of incidents really started to come back. Even though our volumes were still down, you see that in August and September, our incidents actually were more in 2020 than they were in 2019. Our accident comparison, kind of a subset of the total number of incidents. You can see the difference from 19 to 20. And very similar pattern to the overall incidents. The accidents, you see the little lower than the total number of incidents in comparison. But and again, in the summer months, we saw close to normal. They didn't exceed like they did for the total number of incidents in August and September, but they did get very close, even with the reduced volumes. So really kind of an impact summary. So from March 15th to May 30th, through really kind of the peak of the pandemic and the lockdown, we did see a decrease in volume of 53%, decrease in revenue of 45%. Our commercial vehicle volume wasn't hit nearly as hard as our passenger car volumes, which really did save us on the revenue side. And you see our total incidents decreased by 34%, and our accidents were down 47%, which really closely correlates to the decrease in actual volumes. And then when we started to kind of returning to the new normal from June 1st to October 31st of this year, our volume is still down roughly 22%, revenue 26%, truck traffic back to normal, and sometimes they even exceeds the prior year, with our passenger car volume making up most of that 22% decrease. You see, even though we're still 22% decrease in volumes, our total incidents are only down 9%. But just as during the lockdown period, our accidents correlate very closely to our decrease in volumes. Now, during the closure, we did see, as I mentioned, a high increase in work zone speeds, excessive speeding, and the 95th percentile across our entire system, and obviously the increase in the TMA hits, primarily with the PTC maintenance vehicles. And since June 1st, our speeds have really returned to normal, and our TMA hits have really stabilized since then. Other impacts, we were, obviously planning, most of you know, to move to all electronic tolling. We were already planning to do that in October of 21, but we did have to move that up to March of 2020. So with the pandemic, and with similar to other businesses, we removed the toll collectors from the toll booths to remove that interaction with our customers. And they were actually on a few months until approximately 500 toll collection staff were laid off, and they're not returning. It was planned to keep them on board through January of 2022, but they were actually all let go in June of 2020. Now for years, and for I believe a couple more years, we're actually the Turnpike has been paying for those folks to get further education, go to technical school, back to college, whatever it may be. But there is a lot of assistance, and they were also able to keep their benefits through January of 2022. Fare collection staff, which is now our toll collection, that name did change, created a district utility worker position to really help maintain some level of the toll plaza presence. And you can see as other agencies have really kind of experienced, our capital plan did take a hit by approximately 30%. So a lot of the performance related type projects that we were moving forward with over the prior couple years were put on pause for this year. Our fiscal year ends the end of May 21. So we're actively planning and kind of seeing how our traffic returns to see what, if any, of those projects may be able to move forward next year. So with that, I will go ahead and turn it over to Nate Keel. Nate, I'll go ahead and advance the slides for you.
Sounds good. Thanks, Mike. Yeah, so just to cover a little bit about the impacts to our operations for our traffic management center here. We do have quite a unique situation with our traffic operations center as opposed to others. We have this large facility where we answer emergency calls, star 111 calls from cellular phones from customers across the system. Our technicians or dispatchers that you would, their technical job description, are answering all those phone calls, entering incidents into our computer-aided dispatch system, and they are dispatching fire and EMS through a county coordinated response. They dispatch for the entire state for PSP, Troop T. They also dispatch our maintenance personnel to incidents and our authorized service or wreckers to incident scenes. So this impacted our operations by we're not able to have our folks telework. It was kind of like business as usual, but with some other steps that we took to keep people safe. We handle about 12,000 calls a month in the center, phone calls. And as you saw the previous slides that Mike went over, our incidents, that the numbers of incidents that we handle each month. You can go to the next slide, Mike. So as you can see, we went from a large facility that we have there in Harrisburg or Highspire, and we separated our staff. We were notified on a Sunday that we had to have our staff separated by Tuesday. And this is what we went to for the night shift operation. We have a backup location over at the Harrisburg West interchange. Just some concrete block walls and cubicles, but we made it work and we're still making it work. Actually really appreciate the forethought that went into this. We had done a small bug out drill back in January, noted some issues over there that we had remedied prior to COVID. And we were really set to bring our night shift folks over to this facility come the time with COVID when we were told to separate our staff. You can go to the next slide. So our staff operated in two locations. The daylight staff operated from 6A to 6P over at the main TOC, and all of our night shift folks reported to the backup center over at Harrisburg West Shore Interchange. And that was from March 17th, July 2nd. And now we're back in that situation again. We went back over there on November 16th. This time being a completely seamless transition, didn't have near the bumps in the road that we did. Some of the few difficulties that we had, our technicians or our dispatchers, they are union staff. They were initially on 8-hour shifts. They were working 7 to 3, 3 to 11, and 11 to 7. We had to switch all them to 12-hour shifts to limit staff interaction, one shift change in the morning, one in the evening. It increased our overtime cost due to their union contract. Anything over 8 hours was considered overtime, so they got 4 hours of overtime for every shift they worked. Over at our main TOC, we had some other folks in our room. The network control staff, they were moved out of the room again to limit interaction with our folks, keeping them safer. And those that were able to telework from the network control group are still doing that today. Our management staff was separated. Last year, the assistant manager's position, which I am in now, was approved. I was promoted in November, and it seemed like it was perfect timing. Todd Smith, who is the manager of the operations center, stayed at the main TOC over in High Spire, and I separated over to the West Shore Interchange to run that facility. Couldn't have happened at a better time. We had some issues with our phone system. Any other time that we would have bugged out of our center to go to an emergency backup center, we would have had AT&T transfer the phone lines to that center and started answering from there. But it took AT&T back in January over 30 minutes to transfer our phone lines to the other facility, and we knew that that couldn't work. So with the help of our IT staff, they were able to route all those calls to Cisco phones that rang at every facility simultaneously. So we were able to answer the phones at any of the facilities. We do have a backup center out in Somerset. So the phones were ringing out there at the same time that they were ringing at the main TOC, at the same time they were ringing at the West Shore TOC. And obviously, with, you know, as everyone knows, we provided masks, wipes, hand sanitizer. We put up plexiglass dividers between the dispatchers, even though they were 9 feet apart, chair to chair. We put up plexiglass dividers, and also did some assigned seating for them, for the dispatchers before they would rotate through consoles. We did assigned seating to keep 2 people at each console at all times to limit that interaction again. And you can move to the next slide, Mike. Our backup center doesn't come without some challenges. Obviously, there's no video wall over there. We're used to having a radar screen with the weather up on it all the time. And that all had to be displayed on the individual consoles for the dispatchers. We also went down from 4 monitors in front of our dispatchers to 2, which again, it's a limitation, but they made it work. In the early COVID, not currently, but back in the early COVID, we were utilizing a backup IP radio system called IPIX over at our West Shore Interchange. Not very user friendly, and it had a whole lot of drawbacks. We were not able to interact with the county 911 centers on the inter-county radio, and we were not able to provide priority alert tones for certain incidents that we use them for. So the staff in the field had to be more aware, especially on night shift, for those priority incidents without the tones that we were dispatching. And obviously all of our shift handoffs with the supervisors, they had to do all that by phone. We do have a PSP corporal presence in our main TOC 24 hours a day, 7 days a week. as kind of a supervisory staff for the entire state of Troop T. They remained, due to software, computers, phone lines, they remained at the main TOC. They did not come over to the West Shore interchange with us on night shift. So that presented another challenge for our dispatchers to have to communicate with them by phone all the time whenever they needed something. We returned on July 3rd when COVID kind of settled down and cases kind of settled down and we were back in the green, only to return here now in November with the cases on the rise again. And we did, in the time between the whenever we went back to the main TOC and now, we were able to get an agreement with the union because most of the dispatchers all prefer the 12-hour shifts. So now they're on that permanently. Again, that made this much easier of a transition here in November with them already being on 12-hour shifts as opposed to what it was initially. Now I'm not sure what's next there, Mike.
Yep, very good, Nate.
And I think that's it.
Yep,
Thanks.
thank you. I'll go ahead and stop sharing, Dan.
Perfect. Thank you, guys. I appreciate your time. Great synopsis there. I do have one question for you all. I mean, I know, Mike, you were saying that at the beginning, about 14.5% of your volume is typically truck traffic. How did that increase with the decrease of automobiles during COVID?
So during the lockdown, we did see a decrease in our commercial vehicles as well, but maybe by a few percentage points versus 50% or so for passenger cars. And actually truck traffic then really climbed back up to normal as it was in 19 and like I mentioned at times even exceeding it. So yeah, our commercial vehicle traffic really has helped kind of keep us afloat through this time.
Appreciate that. Great, guys. Great presentation. I will turn it over now to Dan Farley and Dave Gaffney, who will talk about PENNDOT'S TMC operations. And same thing for you all, if you could both give a quick introduction to yourselves and your favorite food or meal. Thanks, guys.
Thanks, Dan. My name's Dan Farley, and I'm the TMC operations section chief in PENNDOT'S central office in our highway safety section. And I guess my favorite food would actually be the pizza. I'll kind of turn it over to Dave now. Go ahead, Dave.
Dave Gaffney. I am the TMC operations unit manager. So I kind of oversee the STMC and support the RTMCs. And if I had to pick a favorite food, it's probably a bone-in ribeye with a baked sweet potato on the side.
Nice. Thanks, guys, for sharing.
Thanks, Dan. So today we're going to talk briefly. I'm going to talk briefly about our traffic operations program, and then Dave's going to talk specifically more on how our traffic management centers transitioned during the pandemic and give some good information on that. I do want to say before we get started, we do have kind of an acknowledgement slide at the very end. And really this presentation really kind of is to kind of recognize our district and central office traffic operations support staff, or district traffic engineers, or TMC managers, or TMC operations, and our IT staff that really were very instrumental in making this transition to remote operations very possible and relevant moving forward. So just to give kind of a little bit of a background of the problem, typically these are figures that we typically are getting from our Bureau of Planning and Research, from third-party providers like INREX, our driver license information, and obviously the Texas Transportation Institute's Urban Mobility Report. As you can see, these numbers are relatively high. They continue to increase year after year. Some of the fun facts on the bottom are actually kind of the things that kind of hit home. This does affect every individual that does travel, does operate a vehicle kind of moving forward. So we just wanted to kind of kind of give some context of kind of how our operations, what impact the operations program is trying to solve and really interact with. So our our TSMO program, like many other states, our TSMO goal is, obviously to move people and goods from point A and point B as safely and efficiently as possible. We have established 3 goals that really kind of target both, the planned, unplanned, and congestion-related events. First and foremost, we want to try to maintain, the mobility of planned events. So we want to minimize the impacts of unplanned events and really mitigate reoccurring congestion. And really, these 3 goals kind of really focus and really address our traffic management centers, which our traffic management centers really have their main purpose is for that early identification of incidents and to try to reduce secondary crashes that are occurring. Additionally, they are trying to provide accurate, relevant, timely information on our changeable message boards to get out to those motorists that are actually out there in real time. Our traffic management centers do have 5 key objectives that they try to maintain day in and day out. First and foremost is they maintain situational awareness of our core roadway network. They also try to detect as well as verify proactively incidents that are occurring, both work zone and incidents and other events that may be occurring on that roadway network. In addition to that is also the response and notification. So how are we activating our ITS devices? How are we coordinating with emergency responders, coordinating with existing staff to implement detours and other event plans, and then obviously reporting that in our roadway condition reporting system so we can get that information out to the motoring public. Another key factor is communications and coordination. We try to keep accurate, timely communications with all our stakeholders, all our partners, to make sure that they're all well engaged with situations that are happening, and as they do pop up, and vice versa, trying to keep that open communications with the field to make the field is we're getting that relevant information from the field. And then the last operations objective is really how are we managing or how are we doing that event mitigation, but also continuously try to improve our operations moving forward. So this is kind of our breakdown of our state. We do have, we do break our state down into 4 operational regions. Our statewide Traffic Management Center, which is co-located with Pennsylvania's Emergency Management Center, really is a 24/7 operation. The purpose of the center really is to maintain that statewide situational awareness, to kind of coordinate with our other states as well as other sister agencies in being able to provide those operations. We also do some traffic analysis, traffic analytics to really monitor impacts of major events that are occurring. And then I would ask the last thing that our statewide traffic management center does is they do serve as our area command planning section during major events. So they do provide that situational awareness, that notification to executive staff of what's actually occurring during incidents kind of moving forward. We do have 4 regional traffic management centers. As you can see, each one is responsible for each one of the color-coded areas. These regional traffic management centers operate 24/7 as well. Really, their purpose is to maintain that situational awareness within their region. Really, these guys are the boots on the ground. They do the day-to-day operations, utilizing all our ITS devices, coordinating events, really managing and providing that regional coverage moving forward. The one key thing with this is our eastern region, which is the region in yellow there. We do have 2 district traffic management centers that do operate during are AM and PM peak periods. So there are additional handoffs that do occur in that region as opposed to others. And that kind of relates into the 3 district traffic management centers we do have. So in District 4, District 5, there are daily centers. So Monday through Friday, they operate. And at the end of the PM shift, they hand off to District 8, who performs the operations overnight. In addition to that, we also have District 1, who maintains 24/7 operations during the winter months of from November to April, providing that situational awareness up in the Northeast, really kind of monitoring the impacts of the snow that does occur pretty frequently up there. In addition to that, we also kind of talk about our tools. So we have a wide variety of different tools. Some of the tools that we do provide to really provide an impact is really our the first thing I wanted to focus on is our core roadway network. We have approximately 3,885 miles of core roadway network. Typically, this is our limited access network. We also kind of refer to this as our 511 network. If you're kind of on our 511 website and want to know what that network is. We do maintain almost 1,100 closed circuit TV cameras. In addition to that, I do want to mention with the closed circuit TV cameras, we do deploy portable cameras. Typically what we've done is we put a camera on a old highway advisory trailer and put it out during major sporting events, other types of events, work zone related events during the operational season. And then during the winter months, we actually deploy the devices to rural areas and use them as a permanent device over the winter months, so we can have that situational awareness of what's occurring in some of the rural areas of the state. In addition to that, we have 627 message signs. A lot of these message signs are integrated with our ATMS platform. Really, what we've tried to do with our message sign is begin to start to automate some of the messaging. So whether that's travel time messaging, some of the things we're looking at now are slow down messaging, queue messaging, based on some of the data that we have available to be able to utilize and deploy. In addition to that, our event management data. So this comes in through our roadway conditions reporting system. Really, this information is very critical because this is what we send out through an API to Waze and Google, and then Waze and Google utilizes this information on their platforms. Really, one of the key facts here, as you can see, the 2019 data and the number of events and the breakdown. We did do a comparison looking at 2019 versus 2020 data of incidents that we did have from March 17th to November 30th. We did find we actually have approximately 1,200 more incidents this year than we have in the past in 2019. So I think that'll be an interesting fact as Dave kind of talks about our transition and kind of how we're working in a remote capacity. And then the last thing is our real-time information system. So we're using information from third-party providers, but we're also using crowdsourcing information. We input all that information into a traffic alerts tool. This is an in-house tool that we use to really do that early identification, early warning, as well as verification and validation of incidents in real time. So what this traffic alerts platform does is it brings all these data sources into one GIS user-friendly platform that we're able to kind of monitor and be able to determine the accuracy of some of the events that are occurring in real time. And then the last is obviously our traveler information system through our 511. The one key point I wanted to make with this is we do have our roadway restrictions information on here. So when we do go to commercial or any type of roadway or vehicle restrictions, we do display this on the 511 website. The other key fact with the 511 website is this is a joint project or a joint initiative with the Turnpike. So we both provide information. We both are instrumental in updating the 511 system kind of moving forward. And then the last piece of information I wanted to kind of hit on before I kind of turn it over to Dave is really kind of talk about some of these are our operating tools. Some of these tools have become more critical as we transition to remote communications like Skype, Teams, TMC portal, but did want to kind of give some perspective as we kind of transition here. This wasn't an overnight transition to some of these applications. Our IT group's vision for redundancy, as well as making everything in more of a virtual platform, has kind of let us be able to do some of these applications. The other thing is a lot of tools envisioned were developed to allow flexibility to be able to do it remotely. Think more of a thin client application to be able to kind of move towards that. Another key point I want to make is this transition was a bit of a luck as well. To be honest, we recently kind of went through a software PC refresh. As part of that refresh, it was determined that a lot of the PENNDOT employees were getting laptops as opposed to hard desktops that we had in the past, which allowed that flexibility to be able to transition to a remote environment very quickly. We also kind of transitioned to the voice over IP or Skype video and conferencing platform early on during that. And then lastly, I would say, our working relationship with our IT department has been very helpful, very beneficial as we kind of move forward down the road. So with that, I'm going to turn it over to Dave, who's going to talk more on the transition and how that transition did occur. All right, Dave.
Thanks, Dan. So I'm going to start kind of with our basic timeline, and then we'll go through some of the challenges we saw and try to go through some of the lessons we learned, and then we'll talk a little bit about, kind of what we see for the future. So to start with, on March 12th, we were notified that District 6 was going to get shut down, the TMC included in that, and that the STMC would be taking over operations for District 6 until we could find another solution. We also began planning over the weekend there that all of the RTMCs might be in the same situation, that they might have to shut down. So we started looking at some thoughts, and what we kind of ended up with was distributing some IT equipment, laptops, monitors, mice, keyboards, headsets, all of that stuff to the operators to get them working in remote operations. So District 2, I believe, and District 1 had all the equipment, as well as District 4 and 5. And we had to get the equipment to District 6, District 11, the STMC, and District 8. So we started planning on that. And then once we got them all the equipment, we were able to start remote operations within about 24 hours between the 16th and the 17th. So we have a map here, and this just kind of shows where all of our operators are located. We went from centralized locations, 7 total locations there, and we got the equipment to the operators and were able to begin remote operations within just a few days of that District 6 closure. This is just kind of a summary of the equipment that we handed out. There were 76 laptops that went out to operators. Some of them were shipped via pony trucks, and you can kind of see the pictures there. We sent pony trucks to District 11 and District 6 to get them up and running. And then, we kind of had some empty TMCs. The operators a lot of them sent us in some pictures of kind of what they had done to get their stuff set up in a very short period of time. And I want to highlight what IT did. The laptops, monitors, headsets, all of that stuff that went to the various districts, they all came from IT. They got us all set up with all that equipment. And before the operators got it, they verified that all of the appropriate software was on and that all of the appropriate accesses were installed, so that the operators, all they had to do was log in and they could start working. We also issued some cell phones and hotspots to kind of keep connected. Some operators either had poor connections or they, didn't have an internet at home. So we did issue some devices so that we could keep those operators supporting traffic operations. So like I said, with the TMC home internet capabilities, we did have some challenges there that we, passed out some hotspots, cell phones, things like that to keep them moving. And I wanted to highlight the Skype telecommunication transition. So most of some of the districts were working with Cisco Telecom, and they were VoIP phones, but they didn't have integration with Skype. We created Skype call centers so that when the phone rang, everybody that was set up as an operator for that region got the phone calls. And that was a big lift for IT, and they did a great job getting us set up and ready to go. And there's some other stuff on this slide. I'm not going to go real deep into it, but we did have some challenges, especially with the VPN initially that IT helped us get solved through a new VPN to prioritize TMC stuff. And that did take a little bit. So that was, kind of part of our first month. We had some occasional outages, home internet or power. We did have some changes to the way we focus on monitoring our roads. As I'm sure everybody's aware, it's hard to monitor all the cameras, especially when you don't have your video wall and you don't have as much screen space to look at all of those. So we kind of wanted everybody to shift focus to traffic alerts. And I think that was really helpful that was in place. There was also an INRIX data outage from March 30th to April 6th that, kind of affected some stuff. And you can kind of see some of the other stuff there. And I think, a lot of these are pretty, at the end of the day, are pretty minor challenges that we faced. Everything went pretty smoothly. So to give you some idea of kind of where it went, kind of like the Turnpike, we did do kind of an evaluation of the core roadway network volumes so that we could kind of see, and you can see that real quick drop off when the non-life sustaining businesses closed. And then you see that steady recovery as, kind of stuff reopened and people got, out a little bit more. And now we're kind of in this state where we're about 12% below normal volumes, with truck volumes being closer to normal and passenger car volumes still being pretty far below normal. These are some examples of the messages we've put out, quarantining, and some social distancing, masks, hand washing. And we did try to some extent to keep that, like safety message for drivers, the stay home or the watch speed and following distance. We kind of wanted to tie that back into traffic. We also had one Spanish message request in some specific areas to reach some populations where we felt that there was a need. These are some of the best practices we found. One of the big things, obviously, with the Skype call center. Another one is those continuous meetings. So they're 24/7, and the operators hop in when they start their shift and they sign out when they finish their shift. And this allows, you can pass on information between one shift to the next. It also allows for very quick, easy communications between the operators when they're working. District 8 also used video sharing with their field staff, so they could, log into their iPad or iPhone on Teams, and they could pull up video of the incident. So we kind of had a little bit better situational awareness, especially in places where we didn't have camera coverage. And then last there, the webcads, were kind of working towards a little bit more with the webcads, trying to get up to all of the state covered. And that's coming, but District 2, that's been very beneficial for their work. So we've got some restart plans. We're looking at, what new protocols we'll need, some hybrid TMC operations, how we're going to schedule different people going in at different times, and, splitting shifts between remote and in the office. So we're looking at some of that stuff now. We have developed a couple of plans, and it continues to kind of be a change in target. We want to make sure we're following all of the guidance that we're getting from our executive staff, as well as the CDC and Department of Health when we get back into the buildings. These are just some pictures of what people have set up as their workspaces. We just kind of wanted to highlight the variety that we've seen in the creative ways some of our operators have, turned their monitors or set it up, given their limitations at home, and how they've adapted to the new normal. In our last slide here, this is a list of, we think, just about everybody that was involved in moving to remote operations. And we want to give them all the credit, because they really made this happen. They all were willing to adapt and work with this new normal. So I just wanted to give a thank you, and we'll turn it back over to Dan.
Hey, great job, Dave. Really appreciate it. And for those PENNDOT and Turnpike personnel on the side there, we've got some questions that I pose. If you could answer those through the chat or through the Q&A, that would be perfect. And then finally, and last but not least, Matt Lee, why don't you go and come up and give us a discussion of what's going on nationally at TMCs? Matt, just so you know, you're showing your preview screen. And you might be on mute, Matt. I see you're on mute.
Okay, sorry about that. Can you hear me now?
Now you're good. Thanks, Matt.
All right, good. My name is Matt Lee, and I oversee TMC operations for AECOM. And I'm going to be, we have about 30 TMC operations, and I'll be presenting on how COVID has impacted our operations around the country. And so with that, I'm going to turn this into presentation mode here, which hopefully you can see that. And the topics we'll talk about today is, I'll give you
Matt, just so you know, that's on your preview slide, just so you know.
Oh, okay. Sorry about that.
But just based on time, you can probably go ahead during that.
Yeah, sure. Okay. Our TMC operations, right now we have our operations overview I'll talk about, how it's impacted our coronavirus has impacted operations, what we've done to manage the threat and our desired outcomes, and our creative solutions we've done to help resolve that. Operational overview, we currently have about 800 employees that work in TMC operations for AECOM across 30 TMC locations, everybody from control room operators to leadership cadre to incident responders in the field. Our mission is to maintain traffic flow and safety, and we work primarily for state and local government clients. Our working conditions fall between control room operations and field operations, which include our motorist assist programs. Both of these pictures are from our Virginia Beach operation, which is located in Virginia. How has the coronavirus impacted TMC operations, AECOM's TMC operations across the country? Well, first, it's created a lot of concern over health, financial, and psychological impacts. Not only have we had to adjust employees' schedules and put into place different cleaning protocols, there's also been a lot of psychological impacts on the staff as well, as they've been concerned over the conditions of actually coming to a TMC and working at a TMC in close proximity to their colleagues. And I'll talk a little bit later about how we've effectively helped to reduce that. We've had a lot of educating of staff on coronavirus. A lot of people have become educated on this via, public news and whatnot. Well, we've educated our staff based on AECOM as a staff of nurses and doctors that work for the company, and we came together with a training program for all of our employees to educate them on the coronavirus as it started back in March and to where we are today. We also noticed in our TMC operations a lot of reduced traffic, such as many of the other presenters today talked about. But in reduced traffic, we also had higher impact incidents. Because the traffic was moving at a considerably faster rate of speed, we noticed a lot of high impact incidents, a lot more fatalities, and a lot more need to communicate and coordinate with the incident responder community. We also had an increase in construction and maintenance taking place. A lot of the states have used this time of lighter traffic to advance forward a lot of the maintenance and construction activities that they had planned for the summer months. And so that's been a benefit. And overall, our staff has been reporting high morale. I think that in any situation, when you work in a control room environment, a lot of your staff is motivated and pumped up to do a good job. And I think under this coronavirus circumstance, they even demonstrated how professional they are and really have helped out a lot in demonstrating how, how much they want to do a good job for the public and how much they see this working in TMC as serving the public. So it's a big balance during this coronavirus. We've had to maintain our essential role for the DOT and make sure that we're not slipping on any of our responsibilities. That means maintaining routine operations. And we also had to expand services to relate to COVID-19 by providing safety measures in the control room. And to do that, we have to balance that also with the maintaining staff on site, keeping them informed under the evolving conditions of the virus, especially last spring, as well as providing staff the work-family balance that they need to also manage their personal lives outside of work, because that had a heavy impact on the control room operators in the control room. So our threat management actions included establishing joint AECOM and DOT responses. Everything we did was in lockstep with our clients. And we implemented a weekly COVID-19 response call with all of our managers, and those continue to today, updating them on how COVID-19 has changed, having our medical staff talk to all of our managers and incorporate any of the new measures that come out from the CDC. We also developed an informational warehouse on COVID-19 utilizing Microsoft Teams. So every piece of data or information or tracking sheet is all located in a single location utilizing Microsoft Teams. We also created an acquisition, tracking, and the development of cleaning supplies. We set up a national warehouse for PPE for all of our TMC and field operations in Austin, Texas. And we drop ship supplies of PPE to each one of our TMC operations overnight to each one of our sites, making sure that all of our staff have the best and most readily available PPE. Now, early in the pandemic, we had to actually develop our own cleaning supplies. That meant utilizing formulas and developing our own cleaning supplies from formulas that were put on the website, the CDC's website. We also developed TMC failover preparations, where if one TMC was to become too impacted by the coronavirus, that another TMC would be able to take over operations. This is we call it a failover operation. And we've had to do that in 2 instances, one in Michigan and one in Virginia, where we actually had to fail one TMC's operations over to another center because of the lack of staff that were impacted by the coronavirus. Another important thing we did is we came up with a pandemic response plan. The pandemic response plan is something we developed that all of our centers adhere to. And it really creates checklists and updates and what if scenarios for each one of our managers, supervisors, and frontline employees. We put together a new site protocols based on cleaning their workstations when they leave, and modified schedules. We had to modify our schedules into 12-hour shifts and in some places 10-hour shifts. And we had to make each one of these pandemic response plans location specific. We put these response plans into pamphlets that were provided to every one of our employees, along with laminated cards that fit on the back of their lanyards with specific instructions and reminders of how to handle their job or their role on the project under these conditions of the pandemic. Another thing we developed as part of the pandemic response plan was a risk mitigation strategy. And so what we would do is list every possible scenario that could happen in the TMC and what our response would be to if that was to happen. And fortunately, a lot of these we didn't have to do, but we did come up with, we've had some of these occur. And so every one of our risk mitigation strategies had a plan of what if this happens, what are we going to do so that we were prepared. Threat management involved a lot of client collaboration. One thing was to identify a move to remote operations. Working with each one of our clients, we came up with a capability of moving our operations off-site. This included obtaining hardware, telecommunications equipment, and VPN access for all of our employees to move off-site to work remotely. There are a few TMCs that didn't have that capability, but mostly that was because of VPN restrictions due to firewalls. And we also came up with co-location challenges we had to address with our client. A lot of our TMCs are co-located with police departments and just general DOT staff working through the control room, walking through the control rooms. And so we had to set up protocols to basically restrict the control rooms to only essential personnel in order to avoid having any kind of contamination of the work site. Our desired outcomes, after our desired outcomes from this whole pandemic, if we could gain anything from it, was to have a future strategies, and that came with a pandemic response plan. That's why we wanted to put it together. That's why we continually update it to make sure that we have this pandemic response plan should this ever happen again in the future. We also established a hardware warehouse at each location. Each one of our TMCs now has a warehouse where we have any kind of monitors, laptops, cell phones that can be taken off-site when needed to go off-site. We also created protocols for ITS operations for future initiatives, such as creating a PPE vault. I talked about the vault we have right now in Austin, Texas, where we distribute PPE from, but we also made sure we had minimum inventory list of PPE maintained at each one of our sites. And we're working actively with each one of our clients to change the ATMS system, or hopefully in the future, migrate ATMS systems to a cloud-based environment where operators can go off-site much easier. And we demonstrate this through an AECOM consortium. This is demonstrated through the AECOM consortium value that all these things have proved valuable. Other things, our desired outcomes, is we also explored ways to utilize the TMC to help the pandemic, not just from a traffic standpoint. A lot of our TMCs incorporated messaging for testing queues. We also have had border closure information put onto our SOPs for our TMCs in Texas and Michigan. We also have we utilize the dynamic message boards for identifying where the public can acquire PPE that's made available to the public for no charge. These are just a few of our ways that we've tried to increase the role of the TMC to make it more valuable to the public during this pandemic. And we've talked about, in the interest of time, we've talked about a lot of these topics when it comes to creative solutions, but I'll run through a few more specific things we've done. We've all of our TMCs right now have antimicrobial film over every door handle, and that has helped out a lot. We've also, as my other presenters here today have talked about, we've put up plexiglass between the workstations in order to try to avoid having any contamination between the workstations, as well as space the staff a minimum of 6 feet, but we try to go 12 feet between the workstations. We've also put into place air duct filtration systems into the HVAC systems at each one of our TMCs. This is the same, the one I have up on the screen is the same system used by airlines in their aircraft that they put in place since the pandemic. And it's basically an extra, it uses this needlepoint bipolar ionization technology to further clean the air to make it better in the control room environment. And we've put in place what most of you have probably already seen, these hand-free door stop openers that avoids touching the doors altogether. In summary, it was a lot of teamwork. And as this pandemic continues to worsen over this holiday season, we've learned that one of the best things we've done is just the sharing of best practices amongst all of our operations. And with that, Dan, I'll turn it back to you.
Thanks, Matt. Dan actually had a hard stop at 2 o'clock, so I'm going to step in for him here.
Okay.
We have one question in the Q&A, and that is, we've heard from several presenters over the past 2 days that the numbers of incidents, crashes, injuries, and fatalities during this pandemic outbreak. Has anyone perceived an after pandemic review to hopefully prevent a similar outcome for the future? Could be driver psychological attitude with everything going on, but would be an interesting study. Has anyone approached that thought process for an after pandemic study from the PENNDOT or Turnpike side? I don't know.
Steve, I think from PENNDOT's side, I think we're still kind of in the thick of things. So I don't know if that's even really been talked about at this point. But that is a good point that the individual has brought up as to kind of understanding. One thing I will say is with the construction shutdown, we were able to kind of dissect what the impact of work zones has on our TMCs and the strain it does have on our TMCs. So that is something we're kind of looking to modify long term as a result of this pandemic. But I think, you know, that's maybe one takeaway we've kind of learned already is that, you know, by being able to go down to 0 and then find out how that has affected our TMCs when we brought construction back, that has been a very beneficial information.
Okay, thanks, Dan. Mike or
yeah, same for
Nate?
the Turnpike. Since we're still in the heat of battle, we haven't really thought about it, but wouldn't be surprised if it's something that's studied, maybe even jointly between us and PENNDOT. I wouldn't be surprised with that at all.
And Dan also left me a question for you to discuss. How have you dealt with TMC operators actually having COVID? How have you, covered those losses of time and that kind of thing for personnel hours? Or have you not experienced
I guess
much of that?
Since we're still in, in our centers, I'll let Nate talk about that, because I know that's, since we, still, gather in the same facility, it's obviously, something for us to really kind of juggle when it does happen. So Nate, do you have a response to that?
Yeah, we've been fortunate. Fortunate and unfortunate, I guess you could say. We've had 4 operators out of 24 now test positive. The fortunate part has been it's been 1 here, 1 there, and it really hasn't put a strain on our staff. We're pretty well staffed now with the 12-hour shifts. We are usually able to meet minimum staffing without too much overtime.
Okay.
I would say from PENNDOT's perspective, we do have HR procedures in place that if that does occur, we haven't had that many situations that I'm aware of. Some of our TMC managers have indicated to us that with being remote, it does allow for flexibility for operators that wouldn't typically not cover lesser volume shifts like overnight shifts and things like that, to be able to do that remotely, because it allows for that flexibility. So they've actually had some, less of an issue when it comes to scheduling, where we do have gaps at time for either illness or just vacations or anything like that.
Okay, and with that answer, I think we come to the end of our time for this session. I want to thank everyone for supporting TESC 2020 this year. And if you do have any questions after this session is over, please feel free to email them to tesc.psu.edu, and we will get them distributed to the panelists to follow up with answers. So thank you, everyone. Have a good weekend, and we'll see you next year.